Good morning students, myself Dr. Pooja Saikia, Assistant Professor, Department of Physiotherapy, School of Allied Medical Sciences, University of Science and Technology, Meghalaya. So in my previous lecture, we have talked about different changes in the geriatric, what are the different musculoskeletal, cardiopulmonary, orthopedic changes in a geriatric patient. We have also learned about the different mobility assessment that occurs in a normal geriatric patient. In today's lecture 2 series, we are basically going to assess the mental state of the patient through a well-known reliable scale, which basically we call as the geriatric depression scale. The name of the scale is also known as mood scale. Before proceeding towards this scale, I would like to tell you one thing, that this scale should be only answered in 2 words, yes or no. If you have to ask any explanation, you can ask once you take up the questionnaire or the geriatric scale, alright. So what is the first question that you are basically going to ask? Are you basically satisfied with your life? So what does this question will mean? If the patient is contented with his life, if the patient is having difficulty understanding the question, you have to repeat the question and explain and ask the patient to answer yes or no. Next, have you dropped many of your activities and interests? Suppose in the previous year or when the patient was at a younger state, the patient had a hobby of writing, drawing, cooking, gardening. But whether these activities have been discontinued by the patient, this has to be taken care of, and you should ask the patient to answer me either yes or no. Alright. Next, do you feel that your life is empty? This means that whether there is no purpose of the patient in living forward. Next question, do you get bored? That means the patient has to read his daily activities, and you may need to find out that if the patient is getting bored or not. Next, are you in good spirit most of the time? Now, what does this question exactly mean? Whether the patient is having a positive aura, like the zeal to live further, the zeal to socialize, or whether the patient is having negative thought that he is going to die, that no one is there to support him. That has to be found out by the patient. Next, are you afraid that something bad is going to happen to you? Bad is going to happen to you means death, social discontinuity, discontinue from relatives, discontinue from own children, death, any disease, any attack that is going to come to the patient. Next, do you feel happy most of the time? Is the patient happy? Next question, do you feel pretty worthless the way you are now? This basically means the patient feels that he has no role in day-to-day life. He has no contribution to his society. He has no contribution to his family member. Next, do you feel full of energy? Okay, whether the patient feels sick or whether the patient is having a stamina to do work, that has to be found out. Next, do you feel that your situation is hopeless? That means no hope of going back to positivity. That's everything is being finished and the patient is going to lead a life. That has to be sorted out. Next, do you think that most people are better than of you are? Now, whenever you ask this question, you have to explain to the patient that when the patient is comparing himself, he has to compare with the same old person, not with his children or not his grandchildren, but with the same age group, and compare himself if he is better than others or worse than others, or his lifestyle is similar than others. Okay, so you have to give 1 for every yes and 0 for every no. Okay. So basically what exactly going to give, if the score is basically less than 5, okay, the patient has to go for a follow-up depression. That means the patient has not fall into the category of depression, but the patient is basically going to fall into the depression if he is not treated. And if the patient is having a score your more or less than 10, sorry, equal to 10, then the patient has already came in the state of your depression. Okay, Now, basically, if the score is around 10, that has to be sorted by a psychological counseling or a good certified psychiatrist who can recommend it medicines and also day-to-day counseling. Okay. Now, since I belong to the physiotherapy, now I am going to focus more on the physiotherapy management of the geriatric rehabilitation. Okay. So, there is two things, deconditioning and treatment. Now, what is basically deconditioning? I want to give you a simple example. Suppose you have started with exercise. Okay, you have started going to the gym and you have started doing proper exercise, and after 15 to 20 days, you have seen a good muscle, a reduction in your body fat. Okay, but after some days, you have stopped going to the gym. Okay, and you have stopped doing exercise. That what you see, that you are again going back to your old body shape. Now, this term is basically called as deconditioning. That means something you adapt yourself and progress to a better, but as soon as you stop it, the body basically goes to its old form. That basically we called as the deconditioning. Okay. So, in the older cases, what is basically deconditioning? That means the patient is not going for enough mobility, not mobilizing himself, not walking himself, not doing his day-to-day activities himself. So, what exactly happened? Atrophy will occur. Okay, muscle will become atrophy, bones will become brittle, pain will be there, stiffness will be there. So, that basically we called as the deconditioning. Okay. Now, overall the treatment, since we are talking about geriatrics, the treatment has to be soft and with full assessment. Okay. So, the generalized assessment of a geriatric case, if not suffering from any diseases, range of motion exercise, stretching and strengthening. I want to repeat you one thing, this is the generalized geriatric rehabilitation. Okay, if a person is suffering from any condition, stroke or Parkinsonism, that time our treatment protocol is going to differ, which I will be speaking in the other lectures, your further modification of the lecture. Now, let us come to the generalized rehabilitation. Alright. Now, passive range of motion is given in to prevent complication of inactivity and to prevent contracture formation. Now, what is basically passive range of motion? Something where the patient will require full assistance. Suppose if I bend my hand, okay, if the therapist will assist, that basically we call as the passive range of motion. Alright. Now, active is something when the patient is able to do himself. Okay, I would like to mention you one thing, that if the patient has done something actively, do not assist, because our main goal is to make the patient independently. Okay, ask the patient to do the range of motion exercise actively. If the range of motion is not proper, or you can see there is some restriction, then only you have to go for the passive range of exercises. Okay, now why this range of motion exercises are important? The first thing is to keep the muscle going, that means to reduce the atrophy to the muscle, to provide sensory feedback. Now, what is basically sensory feedback? I am talking, you are listening now. That is a kind of a sensory feedback. You are listening to me, your eyes are looking at my PPT. Okay, this all are coordinated movements. So, when the patient is going to do any kind of active movements, that sensory feedback will come from proprioceptors and neuroreceptors. Alright. Next is this bit. I will explain you this thing. Okay, I am going to say, when performing passive exercise on elbow joint, caregiver should place or support one hand above elbow and other hand on forearm or wrist area while working the elbow joint. Now, what does this mean? Okay, we have certain positioning known as passive movement. Okay, suppose you are trying to do this. Okay, but you put your hands over here, it is going to basically restrict the movement. So, whenever you do passive range of motion, you have to place in such an area that one hand will support. Suppose in the case of elbow, this hand will be supporting and this hand will be doing the movement. So, as you can see, this area is completely free. So, passive range of motion positioning, you cannot like do according to your wish. You have to follow a certain protocol that is given in your proper books, proper reliable scale, and that you have to place. Okay, if the physiotherapist is not able to attend the geriatric patient all day, the physiotherapy needs to guide the patient attendants how to go for the passive range of motion. Okay, now certain stretching exercises are there, like for range of motion exercises, stretching is also divided into active and passive. Passive means दूसरा करके देना. ओके, एक्टिव मीन्स जो खुद करता है उसको हम लोग एक्टिव बोलते हैं. ऑलराइट, नाउ वेट. So certain is there static stretching and dynamic stretching. Okay, now stretching can be divided for geriatrics into two types, static and dynamic. Static means holding a stretch of 30 seconds or more, focus on lengthening on group of muscle, and dynamic is designed to stretch a group of muscle. Okay, now I want to show you certain pictures. Okay, so these are basically the dynamic stretches. Okay, and these are static stretches. In static stretches, as you can see, this is a kind of a static stretches. You will be holding a certain position and then stretch. Remember, you need to get a stretch. It is not simply doing like this. Whenever you do like this, you have to feel the stretch. And dynamic, as the word suggests, you have to go for a movement of the body and perform the stretch. Okay. Now, these are some of the stretches that has to be done for the geriatric. The neck side stretch. Okay, so as you can see, the picture is already being attached. Make the person seated. Okay, place your hand like this and go for stretching. You should feel the stretch over here. Okay, you need to ask the patient whether stretching is felt or not. If stretching is not felt, you have to give a super emphasized stretching. Next is the sat stretch. Okay, so in the older person, yesterday I have explained you how the posture basically changes like this. So this area, the pectoral muscle area, goes for your shortening. You have to basically lengthen the muscle. Okay, so this is kind of a self stretch. Okay, take it on the wall and then go for a stretching. If this is not possible for the patient, ask the patient to put the elbows on the shoulder and then go for a passive stretching. Okay, the pectoral regions are basically going to get stretched. Next is ankle stretch. This is very simple. Take a wall, okay, or a chair and ask the patient to go for a slight dorsiflexion. Dorsiflexion matlab पैर ऐसा करना. Okay, that means the toe should look up when you go for dorsiflexion, and whenever you go for dorsiflexion, your stretch should be felt around the lower part of the calf and the ankle. Next, hamstring stretch. Okay, one thing, this picture may misguide you because to do this type of stretching, you need to have a good hamstring flexibility. Okay, so if the patient can do in this one, supine with a, you can say with a chunri or you can say bed sheet, well and good. Otherwise, you have to ask the patient to stand and take the leg and go for bending on a chair. Okay. Next is quadriceps stretching. Quadriceps stretching will be done always on your prone line. Okay, this the patient will not be able to do. Remember, he is a geriatric patient. If the patient is able to do this stretching well and good, he must have a good flexibility from before. If not, you have to put your hand on the pelvis, okay, and flex the knee till the stretch is felt on the quadricep muscle. That is the front of the thigh. Okay, next, after stretching, these are the general stretching exercise. Okay, I have already mentioned, if the patient is having any kind of condition like stroke, Parkinsonism, osteoarthritis, osteoporosis, treatment will differ, but this is a general exercise protocol. Okay, next is the strengthening exercise. Now, what do you mean by strengthening? Performing the strengthening of muscle. Okay, because in the older age, the muscles will go for atrophy, the muscles will go for weakness, so you need to strengthen the muscle. Strengthen matlab ye nahi hai ki you have to make the patient a bodybuilder. Strengthen matlab restore the muscle strength so that the patient is adequate enough to perform day-to-day activities. Okay, so these are the gist. One by one I am going to explain. Okay, so ankle circle. Okay, the patient has to lie in supine line. Okay, I guess you know what is supine line. Lying with face and chin up to the ground and go for rotation of the ankle clockwise and anti-clockwise. Okay, repeat till 10. If the patient can perform to 20, go for 20. Okay, next is the straight leg raising. Very simple, फिर supine होगा. Okay, now the leg has to be lifted to a point where the other leg is your getting your bent. Why this is necessary? Because the pelvis has to be stabilized. If the patient lifts us above this level, the pelvis may be disbalanced in case of geriatric. So, we always use the other leg as a activity, or you can say a measure to do the straight leg raising. Okay. Next, overhead arm raise. As you can see this picture, okay. So, this old ladies, okay, sorry, this geriatric ladies are using bottle, okay, because you cannot give dumbbell to old patients suddenly. You can give dumbbell if the patient was having a good kind of your muscle, you can say muscle strengthening prior, okay, not suddenly. Otherwise, you have to start with a bottle, give a bottle full of water. It may be according to the capacity of the patient and go for strengthening, okay. You can go for this, okay, or you can go for this and repeat. Okay. In the next slide, we see a lady going for a 0.5 grams dumbbell. Okay. If the patient is able to lift up the bottle, then you can basically progress to going for 0.5 grams dumbbell. Okay. Next, hand grip. What is hand grip? This is a simple exercise. You have to go give those smiley balls that are available very easily in the market, because grip strength decreases, okay. Grip strength decreases after the age of 50 only, okay, and whenever we target the geriatric, we mean the population above 65 plus, okay. So, grip strength will decrease, and grip strength is such a component that can restrict day to day activities, okay. He will be requiring lots of things day to day. So, grip strength is very necessary. Go for smiley ball, okay. There are certain proprioceptor exercises also that we can do, which I will be explaining in the further lecture series, okay. Next, wall push up, okay. So, wall push up, okay, you have to see the capacity of the patient. Ask the patient to stand in front of the wall and go for simple holding, okay. It is basically look like a stretching, but in case of stretching, we will be holding. Strengthening mein kya hoga? You have to come this one down and up, okay, repetitions of the movement. Next, deep chair muscle, okay, this will require a good kind of upper extremity power. Deep chair exercise is contraindicated in patient who is having weak upper limb muscle and trunk muscle, because in this case, you have to hold the chair from back and then go for up and down. So, upper limb ka muscle power proper hona bahut zaruri hai, otherwise the patient may have a fall. Okay. Next, cardiovascular, okay. So, the cardiovascular, yesterday also we have learned about the different cardiac assessment. So, we have seen how the cardiac output gets reduces, how the stroke volume get reduces. So, you have to go for the cardiovascular training, okay. Walking is a base form of exercise. How to incorporate walking? Ask the patient to walk for 15 to 20 minutes alternate days. Then ask him to elongate. If a patient was a walker since before, then you have to go for jogging, okay, because you have to increase the cardiovascular fitness, okay. Next, certain low intensity exercise like walking, moderate cycling. If the patient is comfortable in cycling, you have to go for cycling, but before going all this, you have to check the cardiac status. If the patient is having a pacemaker or any arrhythmia or any cardiac condition, okay, stent and all, whatever, it has to be sorted out. If something is contraindicated, you are not supposed to give, okay. Now, this is very important, okay. This is something out of the physiotherapy. I have just given this slide because we physios will be remaining with the patient maximum 1 to 2 hours, but less staying is all the patient's attendant, okay. So, the home environment has to be very comfortable, alright. Elevated toilet seat. Grab bars on wall next to toilet. As you can see, this type of modification are necessary in case of geriatric patient, because the bones are very fragile. If he sleeps on the bathroom, the fracture neck of femur or any kind of fracture, Colles fracture can be seen in older patient. So, at least when the patient gets up from the toilet with a elevated seat, so that the patient does not have to stoop down, you have to hold the grab. Non-slip tiles in bathroom, okay. Nowadays, in the modern era, everyone's bathroom is filled with tiles, okay. So, that has to be given. Certain skid mats you have to give. This type of skid mats, as you can see in the picture, skid mats has to be introduced to the patient so that the patient does not fall, okay. Next, adjustment of bed height distance from patella to floor, so that when the patient gets down from the bed to the floor, he does not need to jump, he does not need to hold something, okay. He can easily, get out from the bed. Okay, replacement of low chair with more suitable one. Okay, because back pain is a very common problem in old age. So his bed and all has to be, proper. Okay, so that back pain is not gained. Next, marking on and off position of gas range with luminescent marker. Okay, why? Because short-term memory loss even occurs in geriatric person. Okay, I'd like to give you a simple example. One of my patient, he is very healthy. Okay, he stays in my neighborhood, but the problem is that he tries to prepare tea by himself, but while preparing tea he always switch off the upper slab of the gas but forgets to switch off the lower slab. Otherwise the person is very healthy. Okay, so that has to be counteract. Sometimes the old person can forget short things, okay, leaving something unturned. Okay, so that alert has to be there, luminescence, so that as the patient sees, you will remember to shut down. Okay, next, use of handheld tools to retrieve object. A stick, suppose this is a, you can say, a shelf. The patient wants to read certain books or certain medicines. Certain things should be there so that the patient can, come out very easily. Okay, so this lecture series I have wind up. From the next lecture series, I am going to explain you regarding the most common geriatric conditions and how to assess and go for the physiotherapy treatment. Okay, I hope this series is being cleared. If there is any doubt of you people, you can definitely contact me in the physiotherapy department. Thank you and have a blessed day everyone. Thank you.